I'm Judith Park, Director of Acute Services here in NHS Lanarkshire. I wanted just to provide you with an update today on the range of issues that the acute services are currently facing in the increasing demand for COVID. As we currently stand at the moment, we have over 300 inpatients in our hospital acute sites. This is clearly much higher than we had during the first and the second peaks of COVID. And this is requiring us to take some further measures to be able to provide capacity for patients who we think will still come into our hospitals. In discussion with the clinical teams, we've made a very difficult decision to cancel some non-urgent elective activity to try and create capacity on the hospital sites. What we anticipate is that over the next 2 weeks, our COVID positive numbers coming into the hospitals will double, and that will put a significant strain on services and of course, our staffing. So we need to plan now to be able to support patients coming in and provide the best level of care as we possibly can. We plan to continue to be able to treat patients who do require urgent elective surgery, and these are most likely to be cancer patients. And we are also looking very carefully at a targeted response around outpatients as well. Again, this would be to release staff to support inpatient care. However, what we will do is we will contact patients directly if their appointments are not going ahead. And so if patients do not hear from the hospital, they can assume that their hospital appointments will continue and they will be seen as normally. However, we would want to take the opportunity to ensure that any patient coming into the hospital comes alone if entirely possible, uses a mask as they enter the hospital, and takes the opportunity to sanitise their hands, because we must do everything within our power to reduce the transmission of COVID. I understand that this will be upsetting for some patients and of course their families who have made arrangements for elective surgery, but really want to assure you that we are trying to plan to put in place the most robust arrangements that we can to look after the patients who we believe will require admission and good care. Thank you.